Hello and welcome to our next event in our app prep series. I'm really glad that you all are joining me today. I am going to roll through this presentation and then I will take questions at the end. So hi, I'm Jenny Moylan. I'm an advisor here at Health Professions and I use she, her pronouns. I'm going to be talking today about other impactful experiences. You may have heard of this essay previously referred to as the disadvantage statement, and there also used to be a COVID statement. So I'll talk about all of those. Welcome, glad you're here. So what is it? The other impactful experiences statement is a short paragraph that describes your disadvantaged background. It's 1,325 characters. So that puts it at just about the length of a most meaningful work or activity if you were to compare it to your experiences section. It's found in the AMCAS application under biographical information. So you will be asked if you wish to choose to share that you've had a disadvantage and if you wish your medical schools to know that. Well, there are many different types of disadvantage, and we'll talk about each of those in some detail. But the question it might be helpful for you to know is grouped under biographical information within the application. And finally, to note that this is all self-reported. So you know yourself best. You're in the best position to make this decision about whether you'd like to write an other impactful experiences essay for your application. So this is exactly what it's going to look like when you open up your AMCAS application. You'll be asked to, you'll be prompted um, to answer yes or no to the question. And here's the wording of the question. Have you overcome challenges or obstacles in your life that you would like to describe in more detail? And then it further clarifies, this could include lived experiences related to your family background, financial background, community setting, educational experiences, or other life circumstances. And there will be a link in the application for further clarification. So first you select yes or no, and then you go on to fill in the text box with up to 1,325 characters. So remembering that this is grouped with biographical information, what other impactful experiences generally have to do with parent education or employment. So socioeconomic disadvantaged indicator is one tool that medical schools would use to identify applicants who come from socioeconomically disadvantaged backgrounds. And that's intended to assist them in putting your application information in context as part of a holistic review process. And we'll talk more about that holistic review process in a minute. But here are some objective measures that might that help you determine whether you would like to answer yes to this question and proceed with filling in the essay. So this applies to your parents' education and employment. And you can see the table below. Your med schools might like to know if your family has held service, clerical, skilled or unskilled labor jobs, or if they were in executive, managerial, or professional positions, were they holding that position with less than a bachelor's degree? So it could be both education and or employment or a combination of the two. So first of all, we hope that you haven't had to struggle in life, right? But if you have, this is the way to put some words to it. A disadvantage statement might be social, so it might be being treated differently due to your ethnicity, language, orientation, or religion. It might be economic, arising from challenges in receiving any form of government aid or growing up in a single parent household or with an income that's below the poverty line. Or it might be educational. You might have overcome a learning disability, or you might have attended low performing or underfunded public schools. So all of these are objective ways to get started thinking about the challenges that you've had to overcome and what you might like to talk about in your application. So why do they ask and how's this used? They ask in order to promote a holistic review. Um, Asking these kind of questions gives a snapshot of your lived experience, and it puts you in the driver's seat to describe what your experience was. We'll continue in a little bit to look at some actual examples of essays that describe students' lived experience or applicants' lived experience. And it helps your eventual professional school contextualize other aspects of your experiences or identity, right? So if you were working, it may have been hard for you to participate in as many clubs and activities and gained experiences that you would have wanted to. Or it may have impacted how long it took you to figure out how to use the resources here at Davis to thrive academically. Um, it There may have been disruptions in your education. Um, all of those are things that might be nice to be able to give some context or background so that when your admissions officers are looking at your experiences, academics, and personal statement, they can take this information into account as well to help make sense of you as a whole person. Um, Another reason that schools might like to know about other impactful experiences you've had would be to see if you align with the school's mission. Do you share things in common with the communities that the schools serve? You can start researching schools. If we had a nice other um, section of our app prep program on creating your school list. And we would advise that you look into like, where is your school located? What is their mission? And you could even look at the demographics of the population surrounding your school to get a sense of who they serve. Program directors at medical schools are also interested in learning more about the impacts that and experiences applicants may have encountered or overcome. And that can be from any point in time. Um, Again, you get to explain what is important to you and what impacted you. So it could be during childhood, could be during your education, uh, during your undergraduate education, and it doesn't have to be in the field of medicine. Um, all the information that you write in the other impactful experiences section should be unique, not captured in full in other places in the application. So it's not an invitation to like rewrite your personal statement. And we'll talk a little bit more in a minute about how these two things kind of slightly overlap and you're going to have to use your judgment. Okay, so distance traveled is a term that admissions officers use to sort of describe what they're trying to notice. Um, You might also have seen distance traveled as part of the experiences attributes metrics model as something that admissions officers formally take into account. Um, so number one, you should know that admissions officers need to feel confident that you will succeed. Whatever your challenge has been, our hope is that you've learned from it. You've developed a whole new set of skills the hard way. And that you're now in a position to have taken in those lessons or gotten to a place and a situation where you feel confident that you can succeed in their program. Um, One measure of your potential in your professional program is how far you've come or how hard have you worked to get there. There's no question that professional school is going to be challenging. And if you've had to um, work hard to get where you are now, that probably tells your schools that you have the skills, knowledge, social network, language, community support to overcome obstacles, and that's a bodes well for your success in their program. So on some level, they are asking to compare then and now to predict the kind of growth they might see in you between now and the future, if that makes sense. It gives context for your journey and academic preparation for medical school. But the distance travel concept is not intended to penalize an applicant. And medical schools will be very careful to pay attention to um, using that measure correctly. So why the name change? Um, In last year's cycle, the name of this essay changed from disadvantaged to other impactful experiences. If we weren't in a webinar, I would love to check in with each of you to see about how this name change is hitting with you. The goal of the change was to remove unintentionally offensive language and to shift us from a deficit model to recognizing that students who have faced challenges might come into medical school stronger with a whole set of skills that could include knowing how to navigate institutions, knowing when to resist policies that are not working for you, knowing how to leverage all of your strengths and bring those to bear in your education. Actually, on the last slide, I included a research article in the resources if you wanted to learn more about the research that was done that supports this name change. So the AAMC says it would like for you to consider whether this question applies to you. Medical schools don't expect everybody to automatically answer yes to this question. And providing an essay on this question is totally optional. It's up to you to decide whether you would like to let them know about your other impactful experiences. Some applicants may not have had experiences that are relevant to this question, and that's fine. Of course, like we hope that you've had an easy journey. Um, it, but we understand and your medical schools want to know if you haven't. On the other hand, some applicants might feel like, yeah, I have faced and overcome some challenges that has been impactful on who I am now, but I just don't feel comfortable sharing that level of personal information in my application. And that's fine too. So it's for you to decide whether you'll check yes and provide your supporting essay. So, as promised, I wanted to take a moment to compare the personal statement and experiences to your other impactful experiences essay. Will the things that you write about in your other impactful experiences essay overlap with your personal statement? Well, it depends. If your identity was formed through this experience, if it's key to your goals and what you want to accomplish in healthcare, that's great. Weave it into other parts of your application. You probably couldn't explain yourself properly without weaving it in. On the other hand, if this is important contextual information, but it's not central to your professional goals, that's fine too. You might want to emphasize other things in your personal statement or in other parts of the AMCAS application while still providing this important contextual information to your admissions committee. So either way you go, the med schools will understand that it was up to you to make that judgment call. All right, so let's move into actually tackling the writing. So if we were to break down your application into the what, why, and how, you might say that what you did was your work or activities, and that would be shown in your experiences section of your application. We might also say that the why of your activities is shown in your personal comments essay, in your personal statement. And then the other impactful experiences, or formerly called the statement of disadvantage, what would be to tell the schools how. How were you able to overcome your disadvantaged status? Or how do you cope with ongoing struggles? So I think that helps a little bit put common words to understanding, like, what are we talking about when we're talking about context? We're talking about how. And remember, as I said earlier, your admissions officers need to feel confident that you're currently in a situation where you're going to be able to succeed. Whatever the challenges were, we hope that you've learned from them and are applying those lessons, or you've built resilience, or you've found a whole new set of resources. Whatever your story is, we hope that you'll be able to both talk about what you've overcome, but also talk about your confidence that you're ready to succeed. All right, moving on with tackling the writing, moving on to content. So here are our pointers. We recommend that there's a certain level of detail. If you're taking notes, these are good ones to take notes on, because we're going to actually look at some sample essays in a minute. And you might notice in the sample essays where people are giving a complete story or where they're leaving holes. And you might also notice the style of writing. So level of detail is one thing to make sure that you're adding into your writing style. As you know, of course, we are always happy to meet with you um, during advising appointments to help with your writing. Okay, moving on. Tone, you want to be honest and straightforward without being melodramatic. I like a good detail in someone's writing, but you don't want to stir up emotion just for the sake of stirring up the emotion. So think of what you would feel comfortable reading out loud to an admissions officer, right? It should be true and it should be your story, but you don't need to embellish. And that's a fine line to walk between, like, stirring up um, um, upsetting or uh, hard to read images, or stirring up a sense of urgency in your reader, and also really letting them know the truth of what you've experienced. So we'll work on tone. Um, Also, you want to stay in the active voice. So you're going to just be saying, I developed skills, I participated, right? Instead of saying participating in after school programs allowed me to develop skills. So you want to bring it down from this upper level, like looking down on everything, passive voice view, bring it down to your voice, your experience. Overall, we want the structure to be there, be noticeable. Let there be an overview, transition statements, connect the dots, and some personal reflection. Um, it's not, as it turns out, an opportunity to reinterpret the facts, right? So you don't want to say, oh, if I hadn't had to work so hard, my grade would have been better. You don't want to, also don't want to talk about experiences that were beyond your control. Um, so, oh, I'm sorry, I said that wrong. Um, this the factors that you'll talk about are usually factors that are outside of your control. Um, so a factor outside of your control would be like the socioeconomic status, access to resources, um, the um, uh, the preparedness that you came to the university with from high school. So it's not usually factors that are within your control. Like I registered myself for, 400 level courses in a quarter. That might help guide you as to what to include in your essay in terms of content. Um, Also, in terms of tackling the writing, this is note these down because we're going to look at these specifically when we look at the sample essays. So you want to tell the relevant facts. So that might sound like, due to my parents' status as undocumented immigrants, they struggled to find work. As a US citizen, I began working 40 hours a week in high school because I was able to find higher paying jobs. Terrific, right? Very concrete, relevant facts. It will definitely let your admissions committee know what the situation was, and that sets them up to understand the effects on you. So the effects could be, I was forced to miss school to pick up extra shifts, which negatively impacts my grades. Great. That's just what they want to understand from the context, right? This gives them a good understanding of the why you did things the way that you did and how you did them the way you did. Okay. And each of you has agency, right? You're actors, and you're making decisions and making things happen in your lives. So your agency matters here. So you will want to say things like, I talked to my teachers to arrange to make up for missed classes and researched college scholarships designed for disadvantaged students. This kind of thing helps your schools understand what you did to manage in your circumstances. And remember, I was saying that like there's a comparison of then to now to be able to understand now to future. Your agency that you developed through hardship is something that you'll want to talk about and include in your other impactful experiences statement. And finally, we hope that you are thoughtful and reflect on your experience. What does it mean to you to tell this story? Why are you including this particular example, right? You might be able to say, I learned to make the most of my time through utilizing resources and anticipating. Um, Actually, let me go back one. So go ahead and note these down. Relevant facts, effects of those circumstances, your agency, reflection. That is a basic outline of what we'll be looking for in your statements. And I think that you'll notice them in the samples that we're going to look at together. Okay. Tackling the writing, here's some buzzwords that you might include. first generation American, first generation college student, English as a second language, low income or parent careers, field laborers or factory employees. And I guess I'll let you read the rest of the list, but these are concrete terms to describe challenges that you may have faced in before your application that had an impact on your. Okay, so now let's go look at some samples. I started us off with a rough one. Does anybody want to jump in the chat and tell us what some of the areas for improvement for this writer are? An easy rule of thumb is to not start off with a hectic scene um, uh, to engage your reader. Let's trust your reader to be engaged with you and curious without adding the drama of gunshots and helicopters. True, this student has experienced a hardship, right? But I think this example doesn't serve them well because it's it's too dramatic. It's not. Thank you for your comment, Jennifer. It's not formatted in the best way to form a story, and it also it's not getting down to the facts or the impact on the student. Okay, so this is better. Okay, we're using some concrete examples. We're talking about what's happened. My parents were immigrants. I learned English as my second language. My parents divorced as I went through school. Any critique here that you might offer? This student is definitely getting in the zone of being able to explain what their challenges were. Doesn't flow well. Let's look back at our outline. So here we've got the relevant facts. Right, exactly, Jocelyn. They're not showing insight on how it affects them. They do have their relevant facts, right? And they're starting to name out the effects of those circumstances. We don't know much about that student's agency, and we don't see any reflection on how their capacity has been built through that experience. Let's look again. Whoops, here we are. I think they are trying to do some analysis here. College was harder for me than for my classmates. So they're beginning to talk about the impact on themselves. And certainly showing, plenty of agency trying to take care of a situation at home, but I feel like we could go deeper. So let's go next step. All right, better. I'll let you read for a minute and then comment what you're noticing. What would you recommend for this writer? By and large, I've had to struggle on my own to perform in school and understand subject matter. Any suggestions of what they could tell us that would deepen and strengthen this sentence? Let's look back at our outline. So where they're saying that they needed support in school, they might have named out the specific skills they learned, such as like organizational skills, seeking out resources, anticipating. So they're doing pretty well, but I think they could be more specific. Um, and then here's our even better essay. Let me know in the chat what you notice is a strength of this essay. So my parents don't have education beyond the second grade and they don't speak English. Consequently, they've only been able to offer limited support for my educational pursuits. That's great. So now we're talking about concretely what are the relevant facts, and we're starting to notice the impact of those facts on this writer. My parents are both farm laborers. Here we see them using one of the terms from the buzzwords slide. Um, and they've struggled to support our family on their wages. Again, nicely concrete. I began working to support my family at the age of 12, adding a nice detail here. Um, I often had to trade sleep for paid work or school work. Needless to say, I had little time to participate in extracurricular activities. This is right on the nose. This is an example of how this essay can go to support the remainder of this applicant's application. So this provides much needed context to what the applicant might write about in their experience section and what they might write in their most impactful experiences section and in their personal statement. Making it on through college on my own economically and emotionally was tremendously difficult. I attended a high school that was known to be one of the lowest scoring in national exams. Again, very concrete, was not very helpful in preparing students for college. By and large, I've had to struggle on my own to perform in school and understand the subject matter. And then now he's talking about taking initiative. Oh, I'm sorry, I shouldn't assume gender. This writer's telling us how they took initiative to learn to ask for assistance, seek out resources, and take initiative in their own learning. What do we give this student? Shall we give them a round of applause? Should we give them some words of praise? Oh, thank you, Jennifer. Anything you particularly like in this essay and could use if you were writing a statement? When I look at this essay, I think the self-reflection is especially well done. Yeah, so as I look at the recommended content to cover, relevant facts, effects of those circumstances, your agency, and your reflection. Many of us like to be known by our actions and might like to just put it down on paper that I struggled or I worked and let other people form an interpretation about us based on the work that we've done. But in these essays, we get to be the writers. So we get to say for ourselves what message we want them to take away, right? So this author wants their admissions committee to know that they've learned. They've learned to ask for assistance, right? So it's always important in these essays to speak directly to your reader and let them know what you know and what you want them to interpret from your writing. All right. Here are a list of resources that might be helpful to you. The AAMC, let me actually grab these and oh, I'll do it in a second. I'll put these in the chat in a second. But the AAMC has a section on impactful experiences if you want to read more about what they're saying. AMCAS also puts out an applicant guide, which is really helpful just to go through before you start doing your application, or even treat it like a workbook to start thinking about what you're going to fill in your sections of the application. And it's just a little bit friendlier and I don't know, feels more low stakes to read the questions and plan ahead before you're in the application software. And finally, here's the article about self-reported disadvantage in medical school admissions, a call to review, revise, and further advance holistic review. So the changes that were made last year were based on this research, and you can read the original research if you want to here. All right, a little promo here for the next stop in our workshop. We're gonna have another session at 12:10 on April 18th on writing your secondary applications. I'm sorry, I put all the registration links in there. Uh, all about Casper, Kira, and the AAMC preview tests. I'll be leading that one. On May 2nd, we have coming up submitting your primary and secondary. And then on May 9th, we'll have preparing for professional school interviews. And throughout the spring, we'll be having interview practice. Here is a link, and I will also put this in the chat at a time that I will not shut off my whole show by doing that. As always, you don't have to get your advising just from a workshop or from a recording. We're very proud of our programming, but we're most proud of our advising. So come on in, schedule an advising appointment with us, call us, or come to our Zoom drop-in advising. We're super happy to help. Thank you all for being here. All right, as promised, here comes the link for the remaining sessions in our app prep program. Oh, thank you all for being here. Here is a link to the AMCAS applicant guide. There you go. It's been nice spending time with you. Thank you.
Thank you.
My pleasure.